pleased to welcome DC Mayor Muriel Bowser to our program. Mayor Bowser, you have been a champion for the residents of the District of Columbia. Throughout this COVID crisis, your leadership has been outstanding. But today, let's have a conversation about where we are. Have we flattened the curve here in the District of Columbia?
Well, Donna, let me just say is our models predicted that we would be in a lot tougher position today than what we are, but we're still seeing rising case counts, and we expect our surge in cases to come sometime later in May, and surge in hospitalizations and following that.
Do we have enough critical resources for that peak that you're projecting during the month of May? Do we have enough beds and ventilators and PPE for all of those frontline workers?
Well, certainly, not being in the first wave of major cities affected has given us an opportunity to get our medical surge capacity in place. We have outstanding hospitals and hospital systems in Washington, D.C. They have worked hand in hand with our city, county, state to get ready for the surge. So we're adding up to 3,600 beds. We'll have an overflow capacity at our convention center that hopefully we'll never have to use, but it will be in place. We've worked very hard to get the PPE that we need. It's pretty remarkable that we're out in the private market all over the world trying to get what we need for our government purposes, but also for our hospitals. And we're getting to a better place with all of those needs, including ventilators, which FEMA has been very helpful to us with getting the ventilators that we need. But we are still out there asking great doctors and nurses to come to Washington, D.C. In May to make sure that our hospitals have all the staffing that they need.
Given the fact that Howard University Hospital is in the epicenter of this crisis, what, if any, aid will the city need to provide to keep it going to deal with the surge in the next coming weeks?
Well, Howard University Hospital is producing a number of surge beds for us. We asked all of our hospitals to get to 125% of their approved bed capacity, and Howard stepped up to the plate to do that. We are supporting the university and helping build out some of those unused floors. And we've also are supporting all of our hospitals that are getting us a portion of those 3,600 beds with an additional allotment as part of our COVID response, because we know they're taking on a lot to open up this unused capacity and to be able to supervise with their teams and all of their doctors the additional staff that will come on board.
Mayor Bowser, I know you care about all city residents. I've seen you on the news. I've heard practically every statement, read it. But as you know, all across this country in major cities, there's been an alarming increase in the number of deaths in poor communities and the Black community. What can you tell us about the impact that this virus is having in some of the quadrants across the city?
Well, we know that this virus is viciously attacking Black people. And I can't say it another way. When we have in our city a number of deaths are about approaching, if not over 80%, are African American in Washington, D.C., where we make up about 48% of the population. So we know that this virus is attacking underlying conditions that are prevalent in our communities. And it's giving us an opportunity. While we've known about these health disparities in African American communities, that's nothing new. But what how violently this virus is attacking those underlying conditions is really affecting African Americans. The other thing that we know is that African Americans are less likely to be able to stay at home. They are very prevalent in many parts of our country, and especially here in Washington. They are the front line. Nurses and doctors, but also mail delivery people, grocery workers, all of the people who are staffing our DPWs in Washington, there are sanitation workers. These are people who are on the front line and can't stay at home. So not only are they more likely to have conditions that make fighting this virus hard, they're more likely to be exposed to it because they do essential work.
What is the availability of testing? I read just recently the Department of Health and Human Services, there are facilities available in all 8 wards, but what can you tell us about the availability of testing? Is it still coming through our providers, or is there another system in place for people perhaps without health insurance to go and get a test?
Well, we're very proud here, Donna, that almost everybody in Washington, D.C. has insurance, either in the private market, through their employer, or in our expanded Medicaid program. So, approaching 100% of Washingtonians have health insurance. We want to make sure people are connecting to their providers, but we also want that not to be a barrier to getting tested. Yesterday, I expanded the criteria for testing in the district to include not only people that are symptomatic, but people who are in high risk groups. They're senior citizens, they live in congregate settings, they're doing essential work that exposes them, to also call us so that they can go and get tested. We know that there are people who are asymptomatic before they develop symptoms that can carry the virus. So we want to make sure that people who have been exposed, or they may have been around somebody who's tested positive, that they're coming in and getting tested and immediately quarantining themselves. That way, we know when we identify where the virus is, we can isolate individuals. Then we'll be on our path to reopening the city.
What access, if any, have you made available to our homeless population?
We have a very focused effort on vulnerable populations. What we know of the people who have succumbed to the virus in the district,
Go
a
ahead, ma'am.
large portion of them fall into one of our vulnerable populations, which are people who are in homeless shelters, in detention centers, in elderly who live in congregate long term care settings, but also disabled folks supported by the city who live in congregate settings. And They are frequently have other complex health histories. So, getting to those folks and making sure that they're tested, that the staff who support them are properly trained in isolation and quarantining methods and sanitation methods, is going to help us save lives in DC.
Recently, the governor of Maryland, Governor Hogan, received a large allotment. I guess he purchased a large allotment of face masks from South Korea. He had a contact. He's married to a South Korean. She speaks fluent Korean. Um, have you been in coordination with Governor Hogan, or even Governor Northam, on where we are with the District of Columbia? Are they providing any assistance to us?
Well, I don't know that they provide assistance to us, but we certainly coordinate on how we coordinated with how we would shut down our business activity, and we will coordinate how we reopen our business activity. Our region is really closely intertwined. People live in Maryland and work in the district, and people have family all over the region and do other activities all over the region. So it's really, really important that we communicate with a clear voice in the capital region.
I noticed that Senator Chris Van Hollen and others stepped up and spoke out about the district being shortchanged by the Congress and the Trump administration, treating us American taxpayers as if we were a territory. What is the status now on getting the district treated like a state so that we can receive the same amount of federal resources to fight this pandemic?
Well, you know well, Donna, and I know you spent a lot of time working with our Congresswoman Eleanor Holmes Norton, and I know she continues to be very focused on this. We have worked very hard with the administration officials, with members of the Congress on both sides of the aisle, to try to get this business of us being treated as a territory fixed in the last bill. And we're assured by Congresswoman Norton, Speaker Pelosi, Leader Hoyer, that the fix will be made in CARES 4. But it's very serious, a $700 million difference in what we were allotted and what we are owed. And keep in mind that the prevalence of cases in the district is going to require us to mount a serious defense against this virus and to procure and implement testing and contact tracing that would prevent the virus from bouncing back. We are unique in the American system, that is for sure. But in federal funding, it has never been a question over whether we get state funding or not. Our government, unlike any other major city, has city, county, and state functions. And in a federal response model, we're always treated as a state in terms of funding and other disaster assistance. So this has to get fixed. It can be the difference between us being able to fund the types of things that the White House itself has said would be necessary to reopen government.
In addition to my work here at Howard University and of course at Georgetown, I also own a small business. So what, if any, assistance are you providing to small business owners? I'm referring to like Ben Chili Bowl. I'm so worried about many of our small grocery stores, many sole proprietors out there that are losing income because they're not able to open. Even those who are able to provide like grab and go, which I'm famous for now doing. They're struggling now, not only to keep their customers, but more importantly, to keep their employers. So what, if any, assistance is the district providing along with the federal government?
Well, we were able to do a $25 million local, and we're going to be able to fund up to 2,000 small businesses who applied. And that is, in some ways, it's a drop in the bucket. And that is why we were first to get approved from the SBA, the ability to apply for disaster relief. The scope of this problem is so huge that local governments will not be able to provide the type of relief that businesses and workers need. And that's why it's so important that the small business loan program was re-upped, or I guess the House is going to vote on that today. And it's also important, I think we're getting more and more reports that banks weren't treating all businesses equally, and the businesses that are small and have less access to capital didn't get the forgivable loans that they need to keep their payrolls going. So all of that is troubling, and it's going to require significant oversight from the Congress to make sure that those much needed dollars are in use. Now, I'm also an advocate of money going directly to the people who have lost their work. And unemployment is going out the door, but Americans need cash in hand. They need to be able to pay their rent. They need to be able to pay their bills and buy their groceries, and have a cushion for when the economy comes back to build to be able to build those things back. I think that the Congress really needs to consider requirements that some of these bills, that there is not a balloon payment due at the end of the pandemic for mortgages and utilities. And how to get that accomplished, I think it's going to take some national change.
Is the private sector community stepping up to assist you in the work that you're trying to do?
Our private sector for sure is wants to be engaged in thinking through some of these questions about reopening, but they're also really they're really scared for their own future and how to plan to make property tax payments and payroll and get back in business. We're not a Fortune 500 town, and we've struggled with that, with raising funds privately, for example, for the arts. Some cities raise $100 million for the arts, and we started an effort early on to have the private sector help us with closing the digital divide for our schools. I think one of the most heart-wrenching parts of this is that we've had to close schools. And school is a magical place for a lot of kids. They are challenged. They're around great adults who believe in them and want to spark their curiosity and help them learn. They're around their friends. So they're learning a lot of life lessons. And now they're at home distance learning. And that has been certainly a learning process for all of us, for school systems around the country. But what we all is the number of kids who don't have access to technology or the internet, or they may not have the support at home to make all of those things come alive. So, getting kids back to school and being committed to having platforms um, that if we ever have to be away from school buildings, and even when we come back to school, it won't be the same. We have to be in a better position to educate our kids remotely.
Yeah, that's one of my concerns as not only a part-time professor, but I'm really worried about those households that lack internet access. And I know we have a lot of hotspots across the city, and that is a clear challenge that we all have to face and meet. My hometown mayor, Latoya Cantrell, canceled Jazz Fest. She was criticized. I think she made the right decision. Mayor Garcetti, another one of your colleagues from Los Angeles, just announced that he plans to cancel concerts and sporting events until next year. Mayor de Blasio of New York has also announced that they may not be able to have Yankee games. Clearly, as the mayor of the World Series champions, the Washington Nationals, what can you tell us about sporting events here in this region? And will we be able to go and see the Nats play?
Well, I hope that we're going to be able to go to see the Nats play. And it may not be that we can fill up the stadium. And we're going to be working with our sports teams and other large venues. This is a large venue question. And we know that large venue activity was among the first activity to get shut down, and it will probably be among the last activity that comes back, to be quite candid with you. But this is a question not just for sports teams and sports fans, it's for churchgoers, it's for ballet goers and theater goers, it's for concert goers, it's for people who are coming to our town and filling up our hotel rooms to go to conventions. I mean, these are serious questions, Donna, that have a huge effect on the bottom line of a city. In like New Orleans, like your hometown, Washington D.C., the tourism and hospitality industry is really supports city services and our ability to invest in homeless services and public education and everything that makes this a great place to live. So getting hospitality and tourism back is certainly top on our agenda.
Mayor, the president, I'm one of those Americans that watch the president's daily briefings, and he mentioned recently that he wanted to get the city back up and going for the 4th of July fireworks. I mean, Is the Trump administration talking to you and other district officials about what that will look like?
I listened to a clip of him saying that, and I have to think that he was practicing wishful thinking. I wish that too. And if the data suggests that we could have an event like that, I can't imagine that it could be a large event, but that we can have fireworks and some display of our and some celebration of our nation's birthday, then I'd be all for it. I would not be all for it if it was uncontrolled and we weren't in a position to have a large scale event like that. And I think that the medicine and science will be our guide.
That's a very important. I have to ask you, what advice would you give right now to many of the students who are home, not just college students, but also local students who are home and they're worried about their future. They're worried about whether or not they'll be able to work this summer. They're worried about continuing their education. You're a mother. What advice would you give to those parents as well who are still at home trying to keep everything together with their kids and their other family members?
In many ways, I feel it too. Before this pandemic, we were preparing our budget, our city budget, and we were performing so well financially in this city that we would have been able to make some really historic investments in every sector in our city. And just like that, just overnight, those tables turned. And now I'm looking at making a budget where I have $600 million in less revenue. So those types of things and the things that they're doing, before this pandemic, many people had just thriving businesses that were bursting at the seam with restaurant goers, and they had great workers. And just like that, no fault of their own, those businesses were shuttered, and people were trying to figure out how to get back. And similarly, for people in their own households who are just trying to get unemployment or they're trying to telework and educate their child. We are all kind of in this position. If there's one good thing about it, we're all going through it together. So, what I would tell them is we see a light at the end of the tunnel, and we're going to put together a plan to open up our economy slowly and be prepared for any rebound that could happen in the fall. And we have learned a lot about how to turn down the economic activity and turn it back up. The other thing that I would say, as disappointed and quite frankly, as sad as I am about how we've lost revenue because of this shutdown and have to change our plans and change our budget, I'm proud that we are able to do that because we have operated our city and our government in a way that is allowing us to be resilient, economically resilient through this pandemic. And we're going to continue to do that. So they should know when I come to them and tell them that we're ready, it's going to be based on sound thinking. We would have consulted experts. We would have worked with our business community, and we're gonna come back stronger than ever.
That sounds good. Mayor, I would be remiss if I didn't ask you about voting. As you know, the district primary is coming up, and we just saw what happened in Wisconsin, and you saw people risking their lives just to vote. What, if any, steps are you taking or planning to take here in the District of Columbia to ensure that we can cast our ballots safely?
Well, thanks for that question. And our Board of Elections came to me a couple of months ago and um, shared with me their plan to have enhanced mail-in voting in the district as well as vote centers in the district. And so what they will do is advertise and send out to everybody that they should, and I support this as well, request a mail-in ballot. It's very easy. They can do it by email, by app, by calling. Mail-in ballot application to every household. And then every household that is interested in that will get a ballot directly to their address in a secure way. And they can just drop that in the mail free of charge, or they can drop it off at a vote center. The board is also going to have like almost 2 weeks of in-person voting. You know, we would have called it in years past early voting, but it's just voting at 20 vote centers across the district. They're asking people to separate the times that they would go to those vote centers by their name. Over the course of those 10 days, be able to vote in person if that's what they choose.
Thank you so much, Mayor. I want to, first of all, on behalf of Gwen and Kobe, and of course, President Frederick, thank you for your
Thank
leadership
you.
and thank you for supporting Howard University Hospital.
Absolutely. Howard University is a critical link in our healthcare system. And I think as we look at these health outcomes disparities, that Howard has can have a huge role to play in helping people across our nation think about how we never have to talk about these health disparities again.
Well, thank you once again, Mayor, for joining our program, and we look forward to continue to work with you, and to hear all of your recommendations on what we should do next in fighting this pandemic. Thank you for your leadership, ma'am.
Thank you.
This program was produced by WHUT, Howard University Television, and made possible by contributions from viewers like you. Thank you.